Hi, guys. Hey, good morning. Welcome to this live video this morning. I am Mandy Irby. I am a birth nurse, and you are in the right place if you want to learn about hospital birth and COVID-19. So, welcome. Thank you for joining. Where are you watching from? And what questions do you have about COVID-19 pregnancy and birth? Let me know in the comments because there is a lot of fear around giving birth in a hospital right now. And so I want to kind of help answer some questions about that. I have some great ideas. First, we're going to start with an affirmation. So I'm going live every day for at least 5 days in a row. If you've seen my other videos, give me a like. If you're new here, consider subscribing because here we believe that our bodies are powerful. With the right support, we are unstoppable. I totally believe that. And I definitely still believe that even in a pandemic. I believe you are unstoppable. I believe that birth is powerful. And I'm giving you the right support to do that and do it confidently and have an amazing experience despite and in spite of what is going on. So let's talk hospitals. I'm a labor and delivery nurse. I am not working in the hospital right now. I am forever grateful for that right now. I just left the bedside in January 31st. So yeah, I have a little bit of a perspective, but if there are labor nurses watching, please let me know in the comments. And I want to reach out to you and chat with you. And you could be on this channel. That would be awesome. So the affirmation today, I asked my son, who was the giver of the affirmation yesterday, and it was so good. So I'll put the video here, but watch it when we're done, and it'll be down below. And today I said, remember about the Hulk? And you were telling me that story, and he got really excited. And I said, what would the Hulk tell you if you needed to be brave today? And he said, oh, the Hulk would say, just punch through light and blow it up into two fires. I'm not sure if that relates to you today, but sounds very powerful and very exciting and like superhuman strength, which is totally what birth is. It's not every day that you can just tell your body to push a human out, right? Or to grow a human or make a human or multiply, which is super cool. So kind of it's the same. You're kind of multiplying into two fires, except a good kind of glow, not a disaster fire. So the affirmation, to turn that into an actual affirmation that I want you to write down right now. Did I tell you to get a pen and paper out? Yeah, I have you take notes. This is homework. This is not a one-stop shop. That's the class on Tuesday, and I will give you all of my notes there. I have not even made PDFs for these videos because I'm going live every day and I haven't stopped working. When I stop working, I feel sad. So I just keep working. So you're going to write down this affirmation. It is, I will not obsess over things that are out of my control. Okay. So then your homework is figuring out what you have control over, which we talked about a ton on Friday in the free class. We'll talk about on Tuesday. If you haven't registered, go register. The class is limited and it is live. There will be a replay. So if you're working or want to watch it again. We're going to touch on some silver linings today also about the hospital. Yeah. So hospitals are taking steps to keep everyone separated. Have you heard of some of the restrictions going on or the visitor limitations or quarantines? I had a friend in the hospital just this last week, and I said, go ask a nurse for that if something was going on in her room. And she said, I can't leave my room. I was like, oh, duh. So everyone is quarantined, even inside the hospital. I was reading some articles this morning to just make sure that I have the most up-to-date information. And it still sounds like pregnant people are inherently more susceptible to germs and viruses and illness because of their altered immune system. But it does not seem that they are at a higher risk than they normally would be, or that you normally would be for COVID-19 or for the coronavirus. So that's some good news. There are not a lot of studies done, and they're very small, like in under 10 people or under 20 people are in these studies because this is a brand new virus. So that's the information that we have. Hospitals are still saying that you can come in and have your baby and it's a safe place to be. And they are trying to keep everyone quarantined and separated as much as possible. However, I do know that hospitals are still many, I don't know about all, this is a question you can ask if it's concerning to you, of your provider, but many are having a higher, I say on the lot when I'm live, I'm so sorry. More patients, more sick people are coming into the hospital. So if labor and delivery is not incredibly busy and they have staff to spare, they will send their labor nurses to other parts of the hospital to care for patients in other units, like sick people. And then maybe on another shift, those nurses come back to labor and delivery when either it's like in a rotation or you draw from a hat, or now they need more people because their numbers are higher. So that is a thing that is happening. That makes me feel a lot of compassion for our healthcare workers in the hospital. That must be a scary time, even when you take care of healthy people or people who are not sick from COVID. They're still susceptible. They are still having to wear the protective equipment. They are still running out of protective equipment. So I've heard that there's going to be more in stock, but I've also heard of many instances where our providers, our medical staff are running out of masks and eye protection and suits and whatever they're wearing on those specific hospitals. So that's a little frightening, and I can relate with you on that. That's why when I settle and I'm quiet and calm, I could cry at like any moment because it's just a lot. It is a lot. I am not here to sugarcoat. I am here to give you information that is current on March 22nd, and I will keep doing it as information comes up and as your questions come up, because it's a lot. I don't want to give you information overload either. That's why the class on Tuesday is 3 hours. So when to go to the hospital? If the hospital is like a center for sick people, but you're pregnant and you're going to have a baby and you don't know if you're in labor and you have questions like, do you want to go to the hospital and risk getting sick? No, right? So this is a time when you need to really know, when is it a time to go to the hospital? When is it a time to ask questions over the phone? And this is a silver lining, because I feel like you might be focusing on your healthy self and healthy pregnancy in a more educated way, looking for healthy parts and cutting out unnecessary steps. And we'll talk about some unnecessary steps that are being cut out. That's okay, that you can settle into. And I'll explain a little bit about why. But again, as you see in the description, this is not medical advice. This is my opinion. This is just for entertainment. This does not replace you asking your provider these specific questions about your specific situation. Okay, now that that's out of the way, when to go to the hospital? When it is an emergency. That is up for you to decide. But consider the hospital is a sick place. You are risking contamination. You are risking getting sick. You are risking the people that are with you getting sick. Think about the future risk when you go in the hospital. An emergency is worth the risk of maybe getting sick and maybe not getting sick if you're having respiratory distress, if you're having a seizure or have had a seizure. I mean, these are real things that still need medical emergent equipment or, assessment. Bleeding. Okay, so you're going to have to decide, that is bleeding an emergency? Is it something I can call about? But if it scares you and if it's a lot and you're going to decide what a lot is, go, right? And if it's an emergency, there are other emergencies that you may experience that will require or are more safe to be in a hospital for. You can still call your office, your provider, the hospital to speak to the doctor or provider on call. But there are still going to be times when it's an emergency, call an ambulance type thing. That's okay. It's worth it. That risk benefit is worth it. But this is the silver lining, is we are getting very clear on when pregnant people need to be in a hospital. And it is an emergency. It is not because the line was long in the OB office. It was not because it's closer or because now that those reasons of not having a ride to your OB appointment or missing an appointment or kind of having a little bit of a lot of discharge and you're not sure and you missed your appointment, so you might as well go. There are way less appointments in the office now. So that can be handled over the phone unless it's an emergency. All right. So consider that and then look at your affirmation. Don't obsess. If you can't control it, you go and get the best care that you can get. And then you only stay at the hospital as long as you need to. It's okay to get medical care right now. But they don't want you going for like a COVID test, right? They want you going for an emergency. How do I want to, how am I helping this situation? I want you to settle into your body a bit and remove some of the other feelings that are going on. Oh, and if you think you're in labor, right? Like truly in labor, but it's hard to tell if you're stressed, fear, tension, pain. If you are fearful, if you are stressed, if you are tense, you may be feeling some unhelpful contractions. If you're contracting, if you're feeling a little bit of tension, if your sleep has been affected, drop a comment below. Tell me your word of how you're feeling today. I forgot to say that at the beginning. Oh, live. No editing. Tell me your word. How are you feeling today? Mine is not hopeless. My hopeless was last night. I was having a little bit of a low time. I stopped working and I was like, oh. But it's a little, I'm feeling weird today, but I'm seeing some questions. So I'm excited to get to those. If I can help you remove some of the fear by educating, remove some of your tension, worry, concern, if we can work on helping you settle into your body, then the feelings that you're feeling, you can kind of focus on more in a more productive way instead of having a lot of these like, I don't know, is this bad? Like, I can't imagine everything is intensified. So everything you're feeling, you're like, well, I'm not going to the hospital for this, but what do I do? Right? Is anyone feeling that? So getting rid of some of that, either tension, anxiety, unnecessary contractions, stay hydrated, right? Continue your normal routines. Try to get rest through your normal rest routines. Those still apply, more importantly now than ever. So another silver lining is we are trying to stay as healthy as possible. And I know we say that, but we can always do better, right? We can always do better. So that is the focus. Decreasing those weird discomforts that make things confusing can help you know when something is up and when you should call or when you need help. You are getting to know your body, your pregnant body, as it changes daily. I love it. I love it. I love it. Okay, so this is silver lining time. I know this is not happy time all the time. I don't mean to belittle that or diminish that. I'm just trying to help you get into a different perspective because we hear so much crap online right now. So don't take that as everything is light and happy in my world or in your world. We're just pretending sometimes. Fake it till you make it. So that's why we're doing affirmations, because sometimes with law of attraction, if we can focus on the things that we want to happen, that can help. And that's not the case for everyone, and it's not going to turn out perfectly for everyone, and it's going to be different than we imagine. But if we can stick with this is my truth, hopefully that can improve what actually happens. All right, hospitals are trying to educate people. You don't need a COVID-19 test unless it will change the next steps. When would a COVID-19 test change the next steps? When you could potentially infect other people, like medical professionals. That would make sense for them to have a COVID test. Right now, they don't have specific treatment for COVID-19 or this coronavirus. So getting the test is not as important as treating symptoms and staying away from people and minimizing your risk. Okay? I'm not saying that that's not going to change, but as of today is what it sounds like. CDC, World Health Organization is saying you don't need to be like seeking out a COVID-19 test unless it's going to change how you care for people or some next step for you. If you have a fever, this is what Italy, who's been through this, and I have people from Italy watching this week, and I'm so grateful for that. They say, if you have a fever, consider you might have COVID or you probably have COVID-19, and treat everyone the same, like in precautions, quarantine, limit every interaction, and mask up and be very extremely careful because it's spreading very quickly, especially in hospitals. If you have a respiratory illness, consider it could be COVID-19. And also, if you're, I'm like confused on my notes. I'm like scribbling frantically about all of the things I want to tell you, and it's messy. But consider reasons that would increase your risk, and please take universal precautions seriously and immediately. So, distancing yourself. If you think about the future of if you get sick, if you go to the hospital and get sick, your next trip to the hospital is going to be very different. You are going to be in quarantine in a much bigger way, much more serious. If you and your partner go and you're going to find out if you have COVID-19 and it's not really going to affect your care, but you've been around other people, or if you're not taking these precautions seriously, if you're not social distancing, you have a risk of your partner not going to be with you in the hospital because you're going to be screened. The pregnant person who needs medical care to have a baby, either cesarean or you're in labor or you have an emergency going on, you're going to be seen. Your partner is not going to be allowed into the hospital. It's that serious. So dig deep and find a reason that makes sense to you and make you act in a way that it is life or death, because it may not be life or death for you, but babies can be infected by their parents, and we want to take precaution to prevent that from happening. So even if you're sick, you're not thinking life or death situation, we don't have enough evidence. We don't have enough babies and pregnant people that are sick to know really what that's going to mean for you. And for the next few weeks, it could mean you have a mask between you and your baby for a very long time. So I'm considering that. I don't want to scare you. I just don't know if my videos this week have been serious enough about protecting yourself for the next 2 weeks, protecting your birth experience as much as possible. What you imagine it to be right now, it may not look like that if you or your partner gets sick. All right, that's off. That's out. Not to be scary, but that's real. Okay, and that's what's happening if partners are sick and they're left home. Your birth is going to be different. You can still bring someone potentially if you're not sick, but if other people aren't taking this social distancing seriously, then they're going to have symptoms possibly and not be allowed into the hospital. So we don't want that. We don't want a mask to prevent you from kissing your baby when your baby's born. And we can talk about babies with COVID, breastfeeding with COVID. Those are coming up in next videos. But that's my let's get serious for a second about this and think about, why are we canceling prenatal appointments? Why are we distancing? Why are we doing telehealth? Because it's not pregnant people that are sick and my provider's not sick. I just don't get it. Like, we're all fine in my town or in my office. They're cleaning it. That's not what this is about. And think about weeks ahead from now, what it would look like for you if something were to happen to you or your family. So what I hear, and recommendations by the CDC, your provider should be abiding by those, and it would look like canceling non-critical prenatal appointments. Silver lining. What's a non-critical prenatal appointment? We treat pregnancy and health so differently in the United States than they do in other places. We test everyone to find out who's at risk instead of deciding who's at risk, right? We charge our insurance companies for everything. Some things are not critical, okay? And we're going to be finding that out as we roll through this. So those might look like telehealth appointments, meaning you talk to your provider from your home, or you go to the office in a separate room and talk to them from a phone in the office, and they're in another room. That's what it looks like. May not need to be hands-on, or you just need one test and the rest is telehealth over a phone, or it's video chat from your home and they can look at symptoms that you're having. So that's why we outline emergency situations, and that's totally your call. But also, they're going to talk to you on the phone oftentimes if you go in anyway. So calling the office and being like, what do I do in this situation? That's day by day. So if you're like, one leg is warm and painful and maybe swollen, I need someone to look at this, they may say, let me look by video and see what we can do, because they want to minimize the times that you need to go in and be seen. If you go to the office and then you need to go be seen by an ultrasound, what if you could just skip one of them? And that would be the office appointment, and they send you straight to an ultrasound. So that's 50% less exposure than you would have gotten if you went to both of those places. And that's generally how it's done a month ago. That's how it would have been done. Come in, let me assess, charge you, hands-on. Maybe they can continue to watch it. Maybe they can give you another recommendation. If not, they send you for another test, possibly in another office, and then they relay those results to you, possibly in another appointment or over the phone. So one of those might be able to be cut out right now. It's going to look different. It does not mean you're getting worse care or less care. Can you see how that cuts out an unnecessary step that we normally would say is necessary? And that's just how our system works. Okay, so you're not getting less care. It's just different. Only offering in-person appointments for tests that can't be done at home, like glucose screening, because it requires a blood draw. So that's going to look different as well. You might wait in the car. You might drink the juice, wait in the car, get tests, get a blood draw, go back to your car, get the results over the phone. Okay. It's not less, it's just different, but it's still your choice whether you go in or not. So, like I say all the time, ask questions. Make sure you understand why they believe it's necessary for you to go in and risk your health and risk their health. There are 200 people for your one provider. We want your one provider to still be able to catch babies when you go into labor, or still be able to do surgery when you need your cesarean scheduled. So that's why we're also thinking about them. There's very few of them compared to pregnant people. So you're doing your part when you're following those new guidelines and asks of you and being flexible and rolling with the punches. You are practicing for labor and parenthood. I'm proud of you. This is not easy. Sit in. This is not easy. I can talk all I want into a mic and tell you how it should be, but it is not easy. So I'm here. We're here. That's why I love lives where there's a community of you guys talking to each other, because there are so many people in this. It is not easy. So these measures are protecting, other things that might need to be done at the hospital. If you need, or in the office in your prenatal appointment, if you go in, ask and make sure they're doing everything. They're going to be doing this. They're going to wish you were there and to do all of the tests a million times, because that's what they're used to too. That's what your nurses and your providers are used to. So less information is going to be a little for them. They're going to want to get all the information they can, I hope, is what it might feel like when you go into the office and you have a bunch of things that wouldn't normally happen in one appointment. If you're around that gestational age, they might ask to do like all the things. So if that's happened to you, I want to know. I want to know some experiences from prenatal appointments and what they look like this week. I know it's Sunday. You're probably not at the office. But things like the glucose test, they might test your urine and dip it. They might do a blood pressure while you're there. They might send you a cuff to be doing on your own, but they still will be checking it when you go in. They might do the measuring tape on your uterus. They might listen to the baby. They might do a group beta strep test, even though it's not at the exact weekage that they normally do. In order to get more information, they might ask to do that at that appointment. But questions to ask would be, would I have to have this repeated? What did the results show? Things like that, because that's going to be a longer appointment, but less numbers of times that you go in. Are you with me? Questions. If this is helping, thank you for the likes. It helps so much. Helps me know I'm on the right track. And if you have ideas or questions down below, those become videos. So thank you. Put them there. Let's discuss and chat. Share with a pregnant friend. These measures are protecting your pregnant sisters, your pregnant friends, your potentially wannabe pregnant people and friends and folks. So there are so many more pregnant people than there are providers. We want them healthy, strong, and able to work. So that's what we're thinking about too. We're thinking about less risk to us, less risk to our baby, less risk to our people and our partners and our birth team, our new birth team, like we talked about yesterday. We want them all safe and healthy so they can be with us in labor and support us, and we can have an amazing experience. And we want that OB to be working and happy and be able to go home and see their family and be able to go to work again and again to be with us and our sisters, right? Our sisters in this. So questions. All right. Then yesterday's video will be right here, and I welcome the discussion. Please share. Please tell each other what's going on. Good updated information is important to share. If you find something on the CDC that's worth sharing, that's the discussion I want to keep having, instead of the scary, like the end of the world stuff. Really, really actionable, productive conversation is the most helpful at this point. Also, I just saw my little strong mama right there. I have merch. It's down below. You can start decorating your water cup for when you go into labor. I mean, right? Fun things too. We can have fun. I've been shopping a little bit. All right, I have questions. Hey, Morgan from Williamsburg. Hey, Ashley. I know you from North Carolina. People really need to hear that RN, especially. Oh, I don't understand, Ashley. People really need to hear it, especially in a pandemic. I think that's a good thing. Hey, Sonia, watching from Scotland, 34 weeks tomorrow. Congratulations. Grace, I made the live. Whoop. Thanks for doing these videos. With so much unknown in the next 7 weeks, I'm terrified for delivering the first time ever, and it's my third. Grace, you are among friends. This is a scary time. It's overwhelming, and that's not weird. Thank you for saying it. Thank you for being honest. Thank you for sharing that story, because other people are right there with you, and you're not alone. I hope that we can lower that level of terrified with some information and help you with tools of what you can control, right? Things that you can control. You can still control breath. You can still control when you go to the hospital. You can still control being at home and protecting yourself and your family. You can still control a lot of things. We're going to talk a lot about that on Tuesday. If you can join us, that would be incredible. Hey, Nicola. So glad to have made it. Congratulations. Oh, Annie. I was just talking yesterday about how my anxiety is crazy, but it helps to ask myself if what I'm stressing about is something I can control. I love that. I love that. So you're totally on the money with the affirmation today. I will not obsess over things that are out of my control. Yes. So that can go into your provider's discussion. What can I do about this? And they'll give you some things, and then you just brush off the rest. And that is a very simplified version. You can also journal the rest. You can talk about the rest. You can put it in the comments and let me be like, you're amazing. But yes, that is the idea, because we have a lot to be concerned about right now. So if we can understand some of the extra stuff, like let's just go back to being concerned about toilet paper, okay? Because that is much gentler on our hearts than all of the things. Kitty cat, LND is separate from the hospital, women's hospital where I live, and all the rooms are private. So I'm happy about that. That's awesome. That's a reason to get excited. Yes. So that is why when we talked on whatever day it was the other day about home birth versus hospital birth, that's why you weigh your specific situation, because it could be awesome. It could be great. And they don't share nurses and they don't share resources. That could be really great. So many random contractions, Samantha. Yeah. Water, and rest when you're feeling you need it. And then your normal stuff, water and a healthy diet. If you can eat healthfully right now. Grace, I'm feeling okay so far. Nicola, am I saying your name right? Stressed, upset, disappointed with my other two. This was the time to get excited for baby. Now I'm dreading it and I don't want that. Yeah. Wait, I thought you already had your baby. Didn't you already have your baby? Stressed, upset, and disappointed. Yeah, that's okay. That's all right to feel that way. I thought disappointed was a strong word for me this morning. Disappointed for how others must feel about how this is. But yeah, so it's okay. It's okay to sit with that. It's okay to be disappointed. It's okay to write that out and kind of be there a little bit at times. I'm hoping to bring some light into that disappointment so that you can make it a unique opportunity. Like if you have time, because we're home, because we're doing different things, if you have time, you can have like so many belly photos of this pregnancy. That might be totally different than your others. You might have so many birth affirmations made and like doodled beautifully or painted or thrown up on the wall. You might be cleaning and enjoying the what's that called? Like nesting. You might be enjoying the nesting that you're having differently because maybe you were working with those other babies or that other baby. So finding that light, I hope to give some of that with these live videos. But yeah, disappointment I think is common, and yeah, it's okay to sit there. I'm feeling good today. Good. Katie. Samantha, anxious or helpless? Oh, what's the word for not knowing the right choice and feeling like every choice is wrong? Parenting, I think, is the word you're looking for. Really. Yeah, I can hear that. Morgan, with an unmedicated birth result in a quicker hospital visit early discharge during this time? Possibly, maybe. It decreases risk, probably decreases risk for cesarean, probably a little bit, decreases length of labor. So there's that a little bit. Everything kind of adds up a little bit at a time. Unmedicated birth result in quicker hospital stay, early discharge. I'm not sure. It totally depends on the person. Like, I don't know your group beta strep status. I don't know how your baby is going to be doing, but fewer interventions may require fewer interventions. So there's that. It doesn't mean you need to totally change everything about where you're going with your birth plans, but yeah, I think thinking outside the box and kind of giving yourself options for going into labor in a different way or being in labor in a different way, that might require a lot more. I don't think it requires more education and more prep, because I think everyone should have the same education, a ton of it. I think everyone should be ready to not have an epidural, because what if? I think you should be ready to not have all of the benefits of being at a hospital 3 months ago or a year from now, because it's going to look different. We don't know how. We don't know if anesthesia is going to be so strained that your epidural is delayed and you might not get it, or so strained that it might not work well. They might not come back and be able to help troubleshoot it. There's always those risks. I think with a stress system, those risks might be higher, but that's just coming out of my butt. I don't know. I think being ready, having tools, having some breath work, having some relaxation, having some coping methods, having some exercises that are like stretches that you've been doing that go into your ritual and your routine and your rhythm, things that help you relax at home, practicing those and taking them with you and doing them in the hospital. Productive labor positions. Sometimes I tell people when I'm laboring with them, and they say, I don't know if I'm going to have time for an epidural, or they're waiting on an epidural, but they're still uncomfortable. Sometimes they move into productive positions. Like, what do I need to do to get this baby out? And either they get an epidural and the pain goes away, or they get their baby out and the pain goes away. So thinking along those lines, I don't think that's wild. I think that's smart. It's smart to be ready for a lot of different situations. We can continue that conversation in another live. That's going to be on Tuesday as well. I'm super stoked about all of those like golden nuggets that we've thrown into Tuesday's class. It's only 3 hours, so it's like 3 lives, but it's going to be with another educator who's also the bomb, Grace. Our office is doing the 8-week in-office for ultrasound, telehealth for 12 and 16, in-office for 20, telehealth for 24, in-office for glucose, telehealth for 30, in-office for 32, telehealth 34, in-office and 36. Okay, so it sounds like a lot of in-office is still happening. That might change. Oh, you're due June 1st. Okay, sorry, Nicola. Sorry, I don't know how I got confused about that. It sounds like there's still a bit of in-office, but that might change. Like I said, like they might separate those out. You never know. But I'm putting in the link for Tuesday's class. I want to keep hearing this discussion. I'm loving it. I could stay here all day with you guys, but I've been working nonstop. So I'm going to go back to work because I want to give you PDFs. I want to give you a place to go to find all this information that's easy peasy with other resources. That's going to be at birthboldly.com/COVID-19. If you go there, there's nothing there right now while I'm live. If you're watching the replay in an hour or two, there'll be more stuff there. So click the link below. I'm also including the sign up for the online childbirth class on Tuesday with my wonderful friend and amazing educator, Julie. She and I taught on Friday and it was so fun. She uses like little dolls to describe. She knows all about the pelvic floor and the soft tissue. We'll do some yoga moves. We'll do some meditation. She'll give you a meditation sound audio file to be able to listen to. And you're going to get like a book's worth of resources also for homework. You know, I love homework. If you're in Birth Nurse Academy, you know I love homework. So it's limited so that we can discuss and have some community time. So you got to get in quick. We're going to be picking scholarships tomorrow. We're meeting tomorrow, and then the class is on Tuesday at 7:30 p.m. Eastern. So if this helped, thank you for the likes. Shows me that this is reaching people, shows me it's helping. If you thought of some questions while I was talking or while you were listening or while you were typing or journaling, ask them below. They will help other people. I can answer them and they might turn into a video. Videos that are coming up include ways to stay at home longer and go to the hospital, stay at the hospital shorter. Those are like when to go in the hospital in early labor, things like that. We're going to do a fear one, how to reduce fear during COVID-19. How the hell do you control your fear in a pandemic? We're going to talk about some tips and tricks on that. And also, I have one interview coming up at least with a doula who's going to talk about changing policy in her state with the governor and how she's trying to get doulas into the hospital if they want, if you have a doula, how to kind of establish them as essential medical staff for labor, which I think helps reduce the length of labor as well. Well, it's not just what I think, it's evidence. So I think that helps get people in and out faster. And we're going to talk to her about why doulas are important and maybe how we'll continue that virtual support discussion then too. So a lot is coming up. Thank you so much for the love. Thank you for sharing with your pregnant friends. Thank you for watching with your family. I'm thinking of you guys constantly. All the work I'm doing is to just give you more so that you can settle into this crazy unknown place that we're in, because I'm not there. I'm high and mighty behind my mic and I feel helpless. So I want you to have all of the resources at your fingertips that are ever changing. So thank you for joining me and giving me back all of that energy and love. Enjoy your affirmation today. Hang it up on your mirror. You should have 3 by now on your mirror. If you don't, go back and watch them. Get those affirmations, because law of attraction, what you bring in comes out. Did that make sense? That's like dirty joke. Sorry. No. What you put in front of you is more likely to happen. I think heading in the direction. Okay, so when my son is learning to ride a bike, he will ride his bike and I'll say, watch out for people. He will watch that person that he's riding, like trying to ride around, and pedal directly toward that person, because that's where his focus is. That's what his eyes are on. And he's trying to avoid them, but unintentionally, he drives his bike right into them every time. Okay, that's what I mean by affirmations. Keep your eye on what you want to happen, how you want to feel, and your truth that you believe in about you, about birth, or the truths that you want to believe, and head your bike into that direction so that you smack right into that truth every single time. Okay, so put your affirmations on the mirror, put them where you can see them, right above the coffee maker. That's where I would see them, right on the fridge. And you'll get another one tomorrow. I'll see you back here at 10 a.m. tomorrow, Eastern time, and hopefully on Tuesday at 7 p.m. in our 3-hour condensed, all you need, one-stop shop, childbirth education for COVID-19. Bye, guys. See you later.